sorry, I haven't been feeling very well.
Are you okay?
I don't know.
Didn't you only just get out of hospital?
Yeah, I think I might need to go see a doctor again.
It's gonna be okay.
Thank you.
Poor Geraldine. Wouldn't it suck to get sick so soon after hospital, or even while you're in hospital? Geraldine here is probably thinking that it's just a viral cough of some sort she has, but she has actually picked up pneumonia, which in this case is a healthcare-associated infection. Healthcare-associated infections are infections that result from the provision of healthcare treatment. And it's also important to note that these infections did not commence before the healthcare treatment. These infections can occur to patients that are treated in hospitals, GP's offices, nursing homes, and even patients that are treated at home. Okay, so Geraldine Smith, what seems to be the problem today?
I woke up coughing and coughing and coughing. I'm not really sure what's wrong with me.
Okay, so lots of coughing, chesty cough. Okay. Well, let me just have a look at your file. Okay, so you've been to the hospital recently, haven't you?
Yes, I have.
How have you been feeling since the hospital?
I got back and something's wrong. I'm not really
Just
sure.
not feeling great?
Not feeling great.
Alright. I'm going to run a few tests, if that's okay with you, and hopefully we'll figure out what's wrong with you. What a clever doctor. For real though, testing of infections is really, really important in the treatment of infections. And this is also important because infections following hospitalisation are very different from infections in the community. So, very different from the common cold, for example. They are different not only in their pathogenesis, but also in their outcome, which means a different approach to the treatment needs to be taken. Okay, so are you cool if I give you a blood test?
Yeah, well, cool. Yep.
Yep, sweet. I'll just make sure I clean the air enough.
Oh, wait 1 second. Aren't you supposed to be wearing gloves?
Yes, thank you for reminding me. Yes. Wow, Geraldine, lucky you picked up on that one. Our hands are actually one of the biggest transmitters of viruses and bacteria. Bacteria and viruses are the main cause of healthcare-associated infections, and some of the infections are because of microorganisms that actually already exist on you. Although anyone can get a healthcare-associated infection, there are a group of people who tend to be more sensitive to bacteria and viruses. The people who are at higher risk of gaining a healthcare-associated infection include people who are very old and very young, people with underlying medical conditions, people who've had transplants, dialysis and ICU patients, and patients with long hospital stays. Hello Geraldine, how are you feeling? Good?
Right, yeah.
Awesome, you ready for the hernia surgery?
Yeah.
Alright, and just a reminder that for this surgery there will be like a tube going down your throat, and that might give you a bit of a sore throat afterwards, but apart from that, should be fine. Alright, hand it here doctor, thank you.
No worries.
Right, I need you to count backwards from 10. Hook it up, hook it up.
9.
Yeah,
Oh,
yeah, start.
7. 5.
She's good, she's gone. Let's do this.
Yeah.
Okay. Wow, well that seemed a bit dodgy. There are other things that can give you a higher risk to health-associated infections. These include the type of procedure being done and whether an invasive device was used. Although some procedures more than others carry a higher risk of infection, the longer the procedure is, the higher the risk of infection. Invasive devices such as intravenous catheters, urinary catheters and breathing tubes carry a higher amount of bacteria on them and so therefore are a higher risk to infection. Some of the most common healthcare associated infections include urinary tract infections from urinary catheters, surgical wound infections, bloodstream infections and of course pneumonia. Okay, so it's time for the breathing tube, I think. Pass it here, doctor.
Yep.
Thank you.
Shouldn't you change your gloves?
I'm sure it will be fine. Breathe. Whoa, not changing the gloves? Probably a bad move there, as we know that hands are a big transmitter of bacteria and viruses. This is really not good for poor Geraldine here, because not only is she already a patient having a procedure, which increases her risk of infection, but the actual practice of not changing gloves and using invasive equipment increases the risk even more. In Geraldine's case here, the bacteria on the tube goes down the esophagus and enters the lungs, causing bacteria to grow. So the bacteria enters the airways through this breathing tube, and that is the cause of her pneumonia. All done. Maybe I should have changed my gloves. My throat, something's wrong.
Hi, I'm one of the other doctors. I was just wondering if you're feeling alright.
My throat's a bit sore and I feel like I really need to cough.
Oh, that's fine. It's just irritation. It will go after a while.
Unfortunately for patients with having procedures done, side effects from infections can actually come across as discomfort from surgery. You might have noticed that the antibiotics I gave you the other day haven't been working.
Oh, how come?
This is actually because the kind of pneumonia you have is actually resistant to that kind of antibiotic. Whoa, 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 whoa. Resistant? Now that's a big word. Now, when the doctor says that Geraldine's pneumonia is resistant to antibiotics, what she means is that the bacteria causing her pneumonia or infection is resistant to regular antibiotics. This means that Geraldine here has an antimicrobial resistant infection. Antimicrobial resistance is a global health threat and will be said to kill around 20,000 people in Australia alone every year by 2050. Antimicrobial resistance is really prevalent in healthcare and impacts patients because patients that have antimicrobially resistant infections have an increased recovery time, and it can even be the cause of death. Antimicrobial resistance occurs when a microorganism, such as a bacteria or virus, is exposed to antimicrobial drugs, which is displayed in this image right here. The reason that antimicrobial resistance is such a big problem in healthcare settings is that it's very easily spread through either patient contact or indirect contact from healthcare professionals, as well as even just from the surfaces of the healthcare facility. An example of an antimicrobially resistant organism that is very prevalent in healthcare is methicillin-resistant Staphylococcus aureus, which we're just going to call MRSA. MRSA causes skin and wound infection in hospitals, as well as pneumonia, bloodstream infections, which in turn can cause sepsis and death. And MRSA is actually the most common cause of healthcare-associated infections. So, because these antibiotics are not working for you, I'm going to give you a script for a new kind of antibiotic, which hopefully should help you, and let me know.
Okay, alright. Thank you very much.
Bye. So, after the doctor tested the bacteria in the infection, she gave Geraldine here the correct antibiotics, although overprescription is a major problem in the prevention of antimicrobial resistance. There are multiple ways to help the prevention of antimicrobial resistance, and in healthcare that includes hand washing, immediate alerts from the lab about drug-resistant bacteria, and the prescription of antibiotics very carefully.